Hello and welcome to another edition of Reversing Your Chronic Knee Pain. Today I wanted to talk to you about a study that just came out. Looks like it's July 22nd, 2016. Follow the title here. It's Exercise Therapy versus Arthroscopic Partial Meniscectomy for Degenerative Meniscal Tear in Middle-Aged Patients. That could be you. Randomized control trial with a 2-year follow-up. As I said, this was done in 2016 by the British Medical Journal. This study was actually done out of Oslo, Norway. It's a fascinating study. So what they did is they compared meniscus surgery to exercise therapy, and I wanted to tell you about this. Basically, bottom line, it was a 2-year follow-up. It was randomized, so meaning that people just kind of drew straws, if you will. Who's going to get the surgery? Who's going to get the exercise therapy? And then they followed these people for 2 years. At the whole end of the study, they actually found that patients had a 3 in 4 chance of doing better with the exercise therapy as they did with the surgery. Now, honestly, what they said was that at the end of the 2 years, the surgical patients versus the exercise therapy patients actually pain-wise did about the same. That's interesting, right? But the second thing that they found, obviously, is that those that had the exercise therapy actually had, get this, stronger muscles, and they're correlating that to a reduced risk of osteoarthritis. Now, if you're somebody who's taken a look at my knee program and you've recently torn something like a skiing injury, a basketball, volleyball, a car accident or something, the research here is actually saying that it may be better, if there really is meniscal damage, it may be better to get that to actually get that repair right away. But if you're like most of my patients, most of my potential patients who are watching this, you've had this pain for a long time. Basically what they're saying is that there's a 3 in 4 chance that you're going to do better with exercise therapy. So how does this fit in here? Well, if you've already tried physical therapy, physiotherapy, if you've already tried exercise, walking, swimming, etc., and you're still not getting help, then we may need to take it up to the next level. And that's Trigenics together with laser. That's exactly what our knee program does. I'm going to put a link here to both the article and also to trigenics.com to get a little more of an explanation. And I may even put a link of my own explanation for Trigenics. But in short, what Trigenics does is it's re-education of the nerves that are controlling the muscles. So the patient is in the office actually doing exercises while the therapist, that's me, is specifically holding pressures at specific nerve receptors to get a permanent re-education of those nerve receptors that are controlling the muscles, which allow the muscles to strengthen and in some case lengthen. When we do that, we can actually see changes. Oftentimes on x-ray we see that there's more of a gap in the joint, and other times, I just saw one yesterday where we see a patella, a kneecap that's off center, literally center up. Well, the patella, the kneecap, is held together by muscles. So it's an exciting study. I want you to check into it. I always recommend exercise. Check with your doctor, check with me. Exercise is definitely a good idea. If you've tried that, if it still hurts too much and you can't even move, then consider calling my office. We can do an evaluation, a consultation to see if Trigenics together with the laser therapy might be a good therapy for you. Until later, I look forward to seeing you, and I hope you do well.